Good afternoon, good evening. I just want to have a discussion with you on hypertension, a very common condition under the cardiovascular system. So in this discussion, we are going firstly to define what hypertension is. Now, hypertension is a condition in which the systolic blood pressure is greater. The systolic blood pressure is greater than 140 millimeters of mercury, and the diastolic blood pressure is greater than 90 millimeters of mercury, and this is over a sustained period of time. Hypertension, at times we can safely say, will have no definite cause, but of course we have predisposing factors. Now, besides the predisposing factors, we have also factors that will influence blood pressure negatively. And the first factor is blood viscosity. This has to do with the thickness or the thinness of blood volume itself, capacity of blood vessels to expand. Then besides that, even the rate at which the heart is pumping this blood, and notwithstanding infections. Now, the normal blood pressure of an individual is dependent on several factors. At times, it could be age, the weight, the sex, and the immunity of an individual. But of course, the ranges for normal blood pressure could be between 90, that is systolic, to 120 systolic, and diastolic 60 to 80. But of course, there are exceptions where we are seeing an individual having a systolic blood pressure of 130, which we can equally consider to be normal. Now, hypertension is actually considered to be any blood pressure over 140/90 and above. Besides this, the hypertension itself is subdivided into two major types. We have primary hypertension, which is also known as essential hypertension, or idiopathic hypertension, meaning this hypertension has no definite cause, the cause is not known. Then we have secondary hypertension, which will be secondary to a particular disorder that has manifested. Besides this, beginning with primary hypertension. So primary hypertension, the cause is of course not known. It affects the larger population of all the hypertensive cases that are recorded, and it becomes the leading cause of death and disability amongst adults. Now, the reason why it is accounting for the larger mortality rate is because it may exist in an individual and this individual may not even be aware. In certain circles, it will be referred to as a silent killer. Secondary hypertension will arise from known diseases or known conditions, and it is accounting for the difference, that is 15% of all the hypertensive disorders. Now, regardless of the classification, either being primary or secondary, hypertension can either be benign or malignant. Benign hypertension, this one, it is hypertension in which we will notice an increase in blood pressure insidially over a long period of time. And usually It is uncomplicated, mild to moderate. Besides that, death would be so rare, but CVA or shock may be one of the complications for this type. Then we have malignant hypertension. This, of course, is characterized by acute or rapid onset. Patients find it's very difficult to lead normal life, and it will present with critical signs and symptoms, for example, papilloedema, retinal hemorrhage at times with anasaka. So let's begin with primary hypertension. Of course, we have already established that the cause is unknown, but we have associated risk factors. And these risk factors can be divided into non-modifiable and modifiable factors. The non-modifiable factors, these are factors that we have no role to play, we can't change. For example, hereditary with its family history, ethnicity, just being a Black person, of course, will make you susceptible twice or two-fourths to the incidence of hypertension than the Caucasians. Then we have age. Age, of course, there will be it is something that cannot be altered. Yes, so with regards to gender, again, gender preferably those who are 35 years and older, that's in men, and 45 years and above in women, they're susceptible to hypertension. And then when it comes to modifiable factors, this is all about the diet, the activity levels of an individual, and these other related factors. These are things that could be modified. If, for example, someone withdraws from taking a lot of sodium, salt in their food, then definitely this hypertension can resolve. Then besides this, excessive smoking. Smoking cigarettes contain nicotine, which is a potent vasoconstrictor. Caffeine equally has the same effect. Stress, which will lead to massive production of adrenaline, and at the end, hypertension will ensue. With secondary hypertension, the causes are very well known. It is called secondary, as we had indicated, because it is following a certain pattern, because there is an underlying condition. Examples given: kidney tumor, pregnancy, glomerulonephritis, and more. So let's just now focus on the pathophysiology of hypertension. What you are able to see on the okay, that's a second, yes. So what you're able to see on your screen, it's the firstly certain structures that are critical for your understanding. So we will begin with this drop in blood pressure, or if there is anything that is impairing perfusion, maximum perfusion of blood to the kidneys, it will result in the production of renin, and this renin that is produced from the kidneys will be actually act on angiotensinogen that is produced from the liver, and eventually we'll have angiotensin 1. So angiotensin 1 will further be converted to angiotensin 2 by ACE, or angiotensin converting enzyme. And angiotensin 2 is a potent vasoconstrictor. And at the same time, when we have angiotensin 2, we are also going to have ADH, antidiuretic hormone, or aldosterone, that is being produced. Now, this aldosterone will actually lead lead to the absorption of sodium and water, and this will result in an increase in the intravesicular volume. And besides this, already we have said there is vasoconstriction, which has reduced the lumen of the blood vessels to minute, smaller ones. So it is this increase in blood volume against a lumen that is smaller. And at the end of the day, all these factors will lead to hypertension or raised blood pressure. So that's the basics on the pathophysiology of hypertension. Now, besides this, it's also very important to take note that because of the changes that have been noticed, we are going to have a situation where the heart would be pumping blood at a very fast rate, heart palpitations, blurred vision, and it's all about reduction in blood supply. There's poor perfusion to the brain and the retina. We have fatigue due to reduced perfusion of the blood tissues, the body tissues rather. And besides this, we'll have headache due to cerebral hypoxia, dizziness, due to reduction in blood supply to the brain, elevated blood pressure, to factor that we have already established. Epistaxis, bleeding from the nose, can also be noticed. There'll be a lot of pressure, and the smaller blood vessels eventually would rupture. Peripheral edema, this is due to the extravasation of fluid from the intravesicular space to the outside of the blood vessels to the tissues. Papillary edema, it's equally the same explanation as on number 8. Then how do we manage this condition? Firstly, we'll begin with the investigations. History taking would be done. Apart from that, one will also do physical assessment of the client. And besides that, we are also going to do urinalysis just to rule out renal diseases, diabetes mellitus, equally. Blood analysis and full blood count will also review, if possible, some infections. Blood gas analysis can also be done, which may just indicate reduction in concentration of oxygen. Full blood count may review leukocytosis, an indication of infection. Besides this, we can also do echocardiogram to determine the degree of the left ventricular hypertrophy, ECG, just to review the function of the heart. Thermoscope examination to review retinal damages. Fundoscope can also be done. Chest X-ray can also be done, which may just review cardiomegaly. In terms of treatment, I think if you have already assessed this patient and you have noticed the cause could be modifiable factors such as diet, so you need to work on the diet of the patient. Besides that, you can also work on the weight reduction. If it has to be obesity or excessive weight gain, restriction of alcohol, sodium restriction, smoking cessation. We understand in smoke, the cigarettes, there's nicotine. Exercise, moderate exercises can be recommended, such as walking. Caffeine restrictions. Someone needs to be off coffee, off Coca-Cola. Relaxation techniques may also help. Management of stress. This could be through to talking to someone, interaction, and meditations. Now, when we come to a pharmacological treatment, there are drugs that could be given, such as methyl dopa or Adomate, 250 to 500 milligrams. This one, it has an effect of vasodilating and also reduces sympathetic outflow from the central nervous system. And thereby it will reduce on the systematic vascular resistance and blood pressure. Apart from this, we can also give propranolol 8 milligrams already into divided doses for an extended period, like for a month. Now, I should also indicate that it's not like the patient should be taking all these drugs that we are mentioning, but it will be according to the doctor's prescription, and the combination will arise from them. The other drugs that are commonly taken, we have nifedipine, which may come in 10 or 20 milligram presentation twice a day, or OD, dependent on the condition, for a period of a month. And we also have captopril, which could be given 6 to 25 milligrams hourly. So all these drugs could be administered. Apart from that, we can also focus on moduretic, which could be given at times. We can also, of course, we have already said non-pharmacological intervention can be instituted. Lasix can be given if the edema is so extensive, just to promote diuresis. Nursing care will be dependent on the lowering of blood pressure as our ultimate goal, helping the patient to adjust to normal life, preventing any complications. This patient under the environment should be admitted to a very quiet environment, and besides that, it should not be stimulating a lot of visitors, a lot of disturbances, otherwise this will just stress them. Then the other thing that is critical is resting. The environment should be clear, well ventilated. Of course, this will just promote comfort, free from injurious objects. Apart from this, we also ensure that we do observations. We need to do blood pressure every after 4 hours. Okay, and at the same time, we are observing the edema on the patient. We are going to do vital signs at short intervals to just ensure that we are on point. Daily weight checking could be done, psychological care. The levels of anxiety, the disease process also needs to be explained to just allay the anxiety. Besides this, we, of course, will ensure that we use cold compress and so forth, just to have the patient relax diet. We provide all nutritious foods, but with a reduction in sodium. Then, of course, we will try to avoid fast foods, canned foods, sorted groundnuts, and also sorted snacks should be avoided. High fat and high food containing cholesterol in higher numbers should also be avoided. Alcohol, okay? And for sure, even as we are giving this nutrition to this patient, we need to be wary of the amount of fluid that they are taking. On exercise, we are trying to promote regular, but of course moderate exercise that will not put the heart under stress. Then beside this, elimination, avoiding constipation becomes so important, and therefore we need to ensure that the patient is getting foods that are high in roughage, just to promote emptying of the bowels. On IEC, this is just a summing up: salt intake, weight reduction, exercise, and then medication adherence, the review dates if they are given, stress management, In terms of complications, hypertension may lead to cerebrovascular accident. Then apart from cerebrovascular accident, it may also lead to congestive cardiac failure, heart failure, renal failure. So this is all about hypertension in summary, but you will find the notes that will be embedded just under this link that will be provided to you. Thank you so much. If there are any questions, do not hesitate to reach out. I thank you.